Hello, listeners. Welcome to Views on Health. We've invited Dr. Dilini Vipulaguna to be back with us on the program this week. And as you will recall, she is a consultant community and developmental pediatrician covering the Gampha district, a very wide area indeed. And last time around, she spoke of childhood disabilities. And tonight on the program, as a consultant community and developmental pediatrician, the focus is on child protection. One might wonder, what has child protection got to do with health? I would think from a lay perspective, it has everything to do with health, because it's the mental health, physical health, and the overall social well-being of the child that needs to be focused on. And so child protection is an area we like to focus on tonight on the program. So without any further ado, while welcoming your doctor, over to you to introduce the topic of child protection.
Good evening, and thank you very much for having me again in the program, Fatima. So, as you said, it's sometimes people wonder what child protection has to do with health, but it is a huge huge burden we see in our society. If you've been listening to news and reading newspapers, you've been seeing how terribly our children been affected with the abuses that's been reported. But mind you, that's just the tip of the iceberg. So when we talk about child protection, we talk about so many different things. So why it is really important? Because coming back to what we always stick to, the UN Convention of Children's Rights. It says every child has right to be protected from any form of abuse or exploitation. And what sort of abuses are we talking about? So there are so many different ways that child could get abused. It could be just act of commission, somebody's doing something to the child, or it's just act of omission, what we call not doing something to the child, not to protect them. So main things we see, very common things we see, is the physical type of abuses. So like hitting or burning them, splashing hot water on them, restraining them in so many different ways. And very importantly, corporal punishments, which we still see unfortunately in our education system, and at homes as well. So all these goes under physical forms of abuse. And then we have sexual forms of abuse, which again is unfortunately has getting so common with the pandemic, because children been introduced so many digital devices at home for online education, which has led to I would say another pandemic of sexual abuses. So again, this somebody might just think, okay, it's just kind of a rape. No, it is not, because it not only includes the sexual activity, it just could include fondling, touching, or even showing a picture, or just exposing a child to sexual content which they are not ready to be exposed to. And then coming to the most common type of abuse, I would say, but would never report it, is the emotional abuse. How the children are being emotionally harassed in homes, in educational settings, by calling them by names, comparing them, shattering their self-esteem. So many ways that emotional abuse, or just not giving them the nurture or the love. And then you have the act of omission, neglect. As a parent or as a caregiver, we believe as government, the adults should be responsible to look after the child, give the needed protection, love and care, and also health needs of the child. So if a caregiver or the parent is not providing any of these things, mind you, it could be just a health need, it is a neglect in a form of abuse again. And then with this advancement in technology and also so many different socio-cultural circumstances, we have come across so many different other types of abuse. For instance, like exploitation, child labor, trafficking, the getting children into the cyber crimes, and then child soldiers, and also the what we call, now we have changed the terminology, so we call it FII, or fabricated illnesses or induced illness. So like a parent fabricating, or somebody is fabricating the child is having illness and getting unnecessary treatment. So there are so many types of child abusers in the society, and then you can imagine how little we hear. So obviously it's not that we don't have it, but it's not really come out.
Thank you, Doctor. That's very interesting and also very sad that we have children being subjected to this type of abuse, if I may put it that way, various forms of abuse. And I don't think it would be fair to ask you which is worse. Is it this or that or the other? I think they're all as bad, as one cannot actually say this type of abuse is okay, but this is not. No. So, Doctor, have you come across children who have had multiple types of abuse?
Yes. It's very common, I would say, because, as I said, but really remarkable factor is most of the children we see actually are there in the abuse or are being subjected to abuse, not only because of, it's the child is there and then, a stranger comes and does it. No, it's just someone from the known community, or someone really known to the child, which is a very common fact. The most abusers are coming from not the strangers. And it's very sad to see what really led to that abuse is the socio-economic, or it's mostly the family dynamics. So the shattered or dysfunctional families, the poor parenting, all these factors have finally gone out to result in this abuse. So along that way, child has been subjected to all sorts of abuse, been neglected of their needs, have been emotionally abused, and often, if you see a sexual abuse, it's most often those times they've been physically abused, or vice versa. So most of the time we see a combination of abuse rather than a single one, because, as I said, emotional abuse is often overlooked. Most of the children being emotionally abused or neglected.
What age are we looking at?
Well, we are looking at 0 to 18 because that's what the definition of a child is. And I've seen very young infants being abused. Unimaginably, yes, but physically, even sexually. So that you can never think of a range, but you are vulnerable from 0 to 18.
So, Doctor, in Sri Lanka, where our cultural practices, beliefs are so strong, and there's so much of protection also on the other side, and so many, you get the older generation saying, don't do this, don't do that, because this is not good for you. Take care, watch out. With all of that, we still see this happening. As a medical professional, you see this happening. What is it that triggers it off? You spoke of the socioeconomic structure also. Does it mean it doesn't happen in the middle or the upper middle class segment of society, strata of society?
No, I wouldn't say that, because, as I said, there are two. One is dysfunctional families, which for me, I think, is the most important thing. Most of the time what we see is parenting issues, or the family is very dysfunctional, or there has been a lot of mental health issues which has not been recognized or been addressed, and then domestic violence and so many dysfunctional factors in the family. So the children are left alone, children are left to be abused by the partners of the parents, or so many different things. And as I said, when I mean socio-economic, it's mostly, rather than economic, it's social, I would say, because the abuse doesn't discriminate between rich and poor. We've seen very rich, well-educated, well-off families coming with similar abusers just because they've not been. Sometimes there's no family dysfunction. It's just a random situation where a child is being abused by a stranger or someone really known to them. But very most often it's the whole structure has been shattered, and then children are left to be abused, if I put it that way. Yeah.
So how do you cope with this? How do you deal with this? They come to you, or what makes them come to you to begin with? Because you don't know till they come to you.
Yeah, so that's the thing. So what we really do is what we call, we start from the point of abuse and then work to minimize the secondary victimization or further abusers. And we also play a part of primary prevention. We try to, again, same as this, coming and making the public aware, or the schools or the parents aware about it. But how we as health professionals join is we have a national guideline for how we are managing children who come across abusers or violence or and neglect. So according to the national guideline, whoever who presents to different, they can just present to police, they could just go to their teacher, they could just go to a adult, trusted adult, and tell that. So they will ultimately should go through a medical examination, because for us to make sure what has happened to that child. So when they come to that hospital level, then the process starts. So the national guideline specifies how that should happen. So this is not one person's job. It's actually so many partners in this. What we really see from outset is the legal authorities. We only talk about justice and police. But then when they come to the hospital, they go through a medical legal examination, and the mental health specialists look at them. And then, we are a kind of a novel subspecialty, so we don't have community pediatricians every district in Sri Lanka yet. So most of the times it's pediatrician taking up the job, or wherever a community pediatrician is there, they take it up. And we have initial meeting to discuss whatever we find, and then we it's a long process. So we try to make sure the child is medically okay. If they're physically hit or they need medical attention, we make sure that is there. If they've been neglected, they've not had enough food, or their growth is faltering, we address that. If they're coming after a sexual abuse, you look at whether they are pregnant, whether there are sexually transmitted infections, or so many things to look at in the health sector. And then you end up to get the community partners into the health. So it's like, this is like a transition. So they come to us, we do the health bit, and then we plug in the community partners. So we have something called case conference. So we have, institutional case conference. We get all these partners into one place. There are so many partners in the community, and working towards child protection. So for instance, like child protection, National Child Protection Authority, and then probation officers, and then in the district divisional secretary level, there are so many different like child right promotion officers, so many people. And then in the community, you have your Gramaniladari, and then you have your school, educational principals and teachers, and if it is your midwife, so many people are there to protect the child. So we all gather in one room, and then we discuss that child, and we develop a plan how this should be, what should be done for this child and to the family. and make sure that this has not been happen again. And that's how that's basically our role.
So the mental trauma that they go through, could you comment on that?
So that is the most difficult challenge, because to add little bit of kind of science into it, why we are really worried about the mental trauma, it's so when you have this, we use a term called adverse childhood events. So the abuse is part of it because it's adverse childhood event, particularly if it occurs in childhood, young childhood. The science, there's evidence to show that brain produces so many different chemicals inside the brain when you go through these type of experiences, and it really affects how the brain works. And not only that affects how the brain works at that time. So your mental health will go down, your education, your development, everything would go down. But it's not the point. It's not only at that point. It would last for generations. That trauma, actually, the studies have shown it is intergenerational. So a mother who's been abused, actually, that trauma she carries into her motherhood, and that affects how she bonds with her child. So that's why we need to make sure when you detect that trauma, you should prevent further damage, not only to that person, but for the future generations. So that's why the mental, or what we call psychosocial rehabilitation, is so important. That's why we have so many partners. So that's where the mental health specialist or psychiatrist, I mean, when I say psychiatrist, people always get things wrong, because it's not a mental health illness. We always use the mental health aspect of the psychiatrist, the speciality, and then we get their help, and then we get the counselors, we get so many other people making a network to make sure that the healing happens. So that healing process is a very important thing we look at. That's why we follow them up. That's why we make sure there's support in the community, that the healing can happen.
A question I may not be the best at this point in time, but we're talking about child protection. What about the perpetrators? Do you deal with them?
You mean child?
Yes, there's a child or who's abused in whatever way. Won't you identify the perpetrator?
Yes, I mean...
And to deal with that. So that...
If they are children, if the perpetrator is a child, yes, there is a way, because, I mean, the perpetrators could be adults. It's completely different. And then they go through a medical legal examination and psychiatric examination, because most of the time they have mental health issues. If the perpetrator, perpetrators can be children. Sometimes they are less than 18. It's very common. I mean, most of the time physical abusers or even sexual abusers, most of the time, because according to Sri Lankan law, anybody less than 16 years, they cannot consent for sex. So if you are in a sexual relationship, or if you had a sexual contact with someone who's less than 16 years, it goes as statutory rape. So a lot of love affairs these days, and the perpetrators are actually about 17 or just 16. So these are children, who are perpetrators, but still less than 18 years. So they are still being looked at like children. So they have a different way of how the legal system works for them, and also how the mental health support is provided for them.
But if they're adults, what happens, doctor?
The legal action will definitely be taken out, but they also, as I said, have a medical legal examination and a psychiatry assessment. So in that assessment, if they feel that these people need mental health support, they will have the mental health support. But very unfortunately, legal action would take a long time. But as much as possible, police and the justice system been working to make sure that things are very impartial and everything. But there are a lot of challenges in that, the children will be adults by the time the verdict is being given. So one good thing, with the direction of Professor Aswini Fernando in Ragama, they initiated video recording evidence in Ragama, which is in a hospital setting, because the very first one for video evidence was in a National Child Protection Authority. So the children can actually record their evidence then and there and forget about it, rather than going every year to the courts to tell the same thing again and again. And by the time they are 20 years, they actually have forgotten what was the original thing, and then the perpetrator will go free. So that facility is there in Sri Lanka now, which is very good. But if the evidence and everything is properly done, and the things are there, well, the justice will be served, but it will take a long time.
But if they're parents,
Of
the parents are the perpetrators.
It depends. Sometimes, I have not. If you ask a medical legal specialist or a mental health specialist, they work with perpetrators, whereas because we mostly work with victims, we don't come across perpetrators as such. But sometimes, most of the time, they are again victims of dysfunctional families, which I have seen. This is a personal opinion, but most of the time, that's where the perpetrators are coming from.
So how do you handle this? What sort of treatment is meted out to the victims?
So,
it's a long term for sure.
Yes. So it's more like we don't call it even treatment, because it's not kind of a disease. It's something very unfortunate happened to that child. So we focus on so many things, particularly in that case conference I was talking about. So we talk about the placement of the child, where they should go. Should they go back to their home? Probably perpetrator is a father, so they might not be able to. But there probably is a very secure environment in the family. It's just the perpetrator coming outside. So then you just leave that. So, or they could end up in a, the child development center run by the probation department. So, that depends. And then we talk about how the education is going to continue. Now, very important factor that I want to tell our listeners is, people think, particularly when you have, when you've been abused in the society, or even probably if you are just listening, don't ever think your life stops there. Because there are people who have healed their wounds and done better than what they've been doing. There are children who delivered their kids, about 15, 16-year-old girls who delivered their kids, but still went and done their O-levels and done superbly. And the child has gone to adoption, and the life continues. So it's very important to remember that your life doesn't stop at abuse. It's just one unfortunate thing happened to you, but you still can go beyond that. So you really need to remember making sure the education is continued. So it's something very important. It's very challenging, I would say, particularly with the very unfortunately with the attitudes of some of our partners in education, I would say. Certain schools, they don't want to have a child like that. It's very unfortunate, but so that is there. And we talk about how the psychosocial rehabilitation is done, and then the medical management, if that is done, and then how the follow-up in the community happens.
Thank you, Doctor. Once again, time has caught up with us. It's been interesting speaking about child protection. I'm sure there's much more that you can share with our listeners. So, anything that you would like to highlight?
So many things, but I would say child abuse or violence against children is very common. Make sure you are very close with your child. Make sure you teach them important rules of protecting themselves from very young age, even from preschool age. and let them come to you if there is a abuse. Let them have that, and also learn to stand for your child if they've been abused. Never think that is a shame. There are so many support in this country, and the legal system is being improved. So don't ever kind of hide it, because that will let the perpetrator to go and abuse another victim. Thank you.
Solid advice there. And on that note, we end yet another interesting discussion, this time on child protection. Thank you so much to you, Dr. Dilini Vipulaguna, Consultant Community and Developmental Pediatrician covering the Gampaha district. Thank you so much for being with us on the program and sharing your expert knowledge with our listeners.
Thank you so much.
Thank you to Nadira Manamperi for technical assistance. I'm Fatima Razi Kadi saying good night. And looking forward to your company next Monday, same time on Views on Health.